Welcome to Medical Tuesday and the conclusion of our two-part program on childhood obesity with Dr. Joy Maxey.
Children do go through stages, and early on, and one of the great misconceptions is babies need fat. They need fat in their diet. Breast milk is actually pretty high in fat. And so babies and developing human brains need fat. Fat is what insulates the nerves that run from the brain through the spine. It's called myelin, and you need that for good myelinization. And so certainly you don't want to be depriving young children of fat. I have many parents that say to me, oh, well, should I put my 12-month-old on a low-fat diet? And I look at them and go, no, you need to be on a low-fat diet, but your baby actually still needs fat. So let's, we can have a synergistic system here. All the fat you'd like to eat, you give that to your baby, and all the things you want to push on your baby because it's healthy, you eat those things.
So what's the best way to ensure your child stays at a healthy weight?
Well, regular assessment is the best way, and so it's recommended by the Academy of Pediatrics, and we certainly recommend to all of our patients that they have an annual physical exam, preferably when the child is well, so that you've got height, weight, blood pressure. And in our athletes, starting at about age 12 to 13, we have what we call exercise testing, where we have them run in place and we measure their heart rates, before and after, immediately after, and then 5 minutes after exercise, along with blood pressures, to try to detect other problems that they may be having. And so that regular assessment with a review of, and my patients can tell you, every year, and some of them now have learned it so well, they come in, yes, Dr. Maxey, I'm eating more green leafy vegetables than I did last year. Now that might be 1/2 serving a week, but it's a start. It's better than what they were doing. And so to talk about, how much calcium are you getting, what are you doing nutritionally, where are your sources of food coming from, and then what you are doing for exercise. What are you doing? What kind of activities? If you're in competitive sports, are you using the appropriate protective gear, face mask, helmets, whatever? And so an annual assessment to look at those things and then to discuss if the height and weight are fine or if they're not fine or if it's not fine, if you should be concerned. And so let's say that, I had seen you when you were, say, 11 and a little pudgy. Depending on what a little pudgy was, as long as you were within, say, a standard deviation for weight of your height, I would have talked about healthy nutrition and just to redouble and make sure that maybe you weren't having 2 or 3 extra snacks that you hadn't been having earlier, but yet you weren't doing any more activity. And oftentimes we know that as folks get ready to go through puberty, they actually do put on a little body fat, particularly girls. Because the fact of the matter is women have more body fat than men, and there's a reason for that. Fat contains estrogen. Women have more estrogen than men do. And that estrogen is what helps us to produce children. It is also what helps us to maintain healthy hearts and strong bones so that we can bear those children and keep up with those children and get them raised to adulthood. And so for that reason, you will see both girls and boys put on a little fat before they enter into puberty. And then oftentimes you'll notice that sort of that fat goes away once they've completed their puberty cycle. And we would expect that. Now, if the fat persists and becomes more, then again, we have to redouble and look at, what are you really doing for activity? And then what are you doing for diet? And those are always the first 2 things. Everybody wants to, it's their thyroid. I have a gland problem. Yeah, you have a gland problem. It's the one in your brain that keeps telling you to eat because you're bored. And so to help folks to become aware of why are they eating. We do a lot of mindless eating in front of videos and TVs and movies and the like. And now it's not a matter of going to the movie theater. We all have a home theater. And so we can eat to our heart's content. And if you were to ask the next 6 people you came across, well, what did you eat while you were watching the DVD with your friends last night? Most of them couldn't tell you. And that's a lot of empty calories usually for most people, and that's another big factor in the American lifestyle. But there are people who do have thyroid disease, and certainly if you have signs or symptoms of it, if you have a family history of it, is something that we screen for in our patients when we're looking at why is there a weight problem. Likewise, there could be other hormone conditions, adrenal glands, things of that nature that could be problematic. And so we want to look at all of that and make sure that things are as they should be. But remember that one of the biggest hormone problems that we see as a result now of obesity, type 2 diabetes, is on the rise in adolescents because of the overweight issue. And so basically what happens is you consume a lot of carbohydrates. Your pancreas's job is to make enough insulin to take care of all that carbohydrate. And any carbohydrate that you're not using either goes into short-term stores, okay, that you'll use in the next 8 hours because you're going to go practice baseball or soccer, or if you sit there and play computer games for the rest of the day, it goes into long-term storage, which is fat deposits, okay? And so when you have somebody who is eating a lot of carbohydrates and their insulin levels rise, then all of a sudden you've got these high insulin levels and no carbohydrate to match up with it. Well, then your pancreas starts going, hey, where's the carbohydrates? It sends a signal to your brain. Your brain goes, my God, I'm ravenous. And you go out and eat some more. So it's just this, vicious cycle of more carbs, more insulin. And then you've got type 2 diabetics. And we're seeing more and more of this in kids. So it's important the kinds of carbohydrates you're eating. It's important the kinds of fats that you're eating. And eating is not like smoking. Smoking's bad, period, end of discussion. There's not anything good about smoking. Eating is something that's necessary. You can't not eat. We can have another show another day about folks with eating disorders, anorexia and bulimia. But you don't want to eat too much. So it's, again, back to balance and having the right information about good fats, good carbohydrates, good proteins, and making sure that that's what our young people are getting in their daily diet.
Dr. Maxey, thank you so much. A lot of great information. That's going to do it for us. We'll see you right back here for another edition of Clubhouse Gas.